How does exposure therapy work for claustrophobia? Imagine being stuck in a small room with no way out. For many, this thought can trigger intense fear and anxiety. This fear of enclosed spaces, known as claustrophobia, affects countless individuals. But there is hope through a method called exposure therapy. Let's break down how this process works. Exposure therapy is a part of cognitive behavioral therapy, which aims to change unhelpful thoughts and behaviors related to fear. The first step in this therapy is to identify specific situations that cause anxiety. These situations are then arranged in a list, starting from the least frightening to the most distressing. This list is known as a hierarchy of fears. The therapy begins with the least anxiety-provoking scenario. For example, a person might start by imagining being in a small room. This is called imaginal exposure. It allows them to confront their fear in a safe and controlled way. Once they feel comfortable with this step, they can move on to real-life situations, known as in vivo exposure. This might involve standing near an elevator before eventually riding in one. A key aspect of exposure therapy is to reduce avoidance behaviors. When someone avoids a feared situation, they miss the chance to learn that they can handle the fear. By repeatedly facing these situations without escaping, the individual learns that their anxiety decreases over time. This process is often referred to as fear extinction. Cognitive restructuring is another important part of this therapy. It involves identifying and challenging irrational thoughts about enclosed spaces. For instance, someone might fear suffocating in an elevator. During therapy, these thoughts are examined for accuracy and replaced with more realistic beliefs. This helps to support the emotional and behavioral changes achieved through exposure. Neurophysiologically, exposure therapy can lead to changes in how the brain processes fear. It increases activity in areas of the brain that help regulate fear responses while decreasing activity in the amygdala, which is known as the brain's fear center. Over time, these changes help lessen the intensity of fear responses. Typically, exposure therapy for claustrophobia requires several sessions, often between 5 and 10, to see lasting improvement. By the end of treatment, many individuals experience a significant decrease in fear and avoidance behaviors. This allows them to engage more freely in situations involving enclosed spaces. In summary, exposure therapy works by gradually confronting fears in a controlled manner while also reshaping thoughts about those fears. This combined approach helps individuals manage their anxiety and improves their ability to cope with feared situations.